which will include all faculty and staff that operate within a school or within a district. So that's teachers, that will be for custodial staff, food services staff, any and all employees connected to a school or a district. Those will be the folks that will be slated for that vaccine deployment. That is all the information I have on that at this point in time. Know that there will be future webinars where we will dedicate the majority of that time up to vaccine deployment and what that means. We may even be reaching out to some of you to get feedback on the logistics in terms of that deployment for vaccine as well. CDC quarantine guidance. So let's jump over to that really briefly. We've had a couple of questions, and to answer your question, Mr. Clark, really quick, yes, it will include contracted staff such as janitorial. Any staff that operates on a school premises will be slated and approved for that vaccine when the deployment does occur. Okay. So for the updated quarantine guidance, again, I want to remind everyone that the CDC does recommend a period of 14 days for quarantine. However, if an individual is masking with fidelity and following mitigation guidance, you can potentially shorten that quarantine to 10 days if there's no symptoms that have been reported during daily monitoring, and that's without a test, okay? So know that there's a threshold between 1% and 10% of individuals who may develop symptoms in a 14-day period rather than a 10-day period. However, we feel that that's an appropriate percentage to make up for some of the economic benefits as well as the support benefits that school districts would need in terms of this shortening of quarantine. The second and really important piece here, though, is that when diagnostic testings are resources are sufficient and available, which right now they are, quarantine can end after day 7, which means a return on day 8. If a diagnostic specimen test is negative, it means someone takes a COVID test, PCR only, that's the full nasal swab, and there's no symptoms have been present during that entire time. The test comes back negative. The test specimen has to be collected 48 hours prior to the time of planned quarantine discontinuation. That's around day 5, 6. Then that quarantine can be discontinued and they can return on day 8. Okay, so this continued symptom monitoring and masking must be met regardless of which throughout that period of abbreviated quarantine. So again, important guidance that's been coming out. We are waiting for the CDC to draft out some kind of visual format communication around this that's a little bit easier to distribute and cover. So look for that. As soon as that comes, you'll see the health department put that out as well. Local legislation points that are important to consider. We have the health department, the county memos have this specific page, which is linked on the agenda. You'll find a lot of really important information in terms of the local legislation, county level that's being implemented within our community at this point in time. Some things of note are the recent White House Coronavirus Task Force recommendations for Arizona, and then the COVID-19 restrictions related to curfew and the vaccination plan. I'm going to pull that up briefly. So on this particular memo, we know that it's talking about the enforcement of a mandatory curfew. I know that our guest from the City of Tucson is going to share out a little bit about that on the city side of things. My understanding and my observations have been that the city and the county are working really closely together on this to try and make sure that there's overlap in enforcement and overlap in the actual legislation of what this curfew means. And the last pieces of this is that just outlining that there is a vaccination plan in place, and we are working hard to try and get that detailed and outlined for everyone on this call and in other areas of the community. I'm going to jump back over to the chat because I think we have a couple of questions that just need to be addressed. To clarify, only PCR. So the county is only accepting PCR in terms of the shortened quarantine, which is the nasal swab, not nasal swab. That's horrible. Nasal swab. And Sarah, I will triple check that guidance just to make sure. But yes, Megan Joyce, what is guidance on retesting? If confirmed cases retest positive 2 weeks after their first positive test, the close contacts restart their quarantine from the second positive test, or just keep the quarantine from the first positive test? Megan, once you have your first positive test, it is a mandatory 10-day isolation. There is no testing out of isolation. And there have been a significant number of cases where viral shed can continue to occur after a 10-day period. In fact, I have a document up on that from the CDC that talks a little bit about that right here. Available data that persons with mild to moderate COVID-19 remain infectious no longer than 10 days after symptom onset. However, there are some cases where this where viral shed does continue to occur. That there is a susception to reinfection after 90 days. Where was that piece in here? I'm going to drop this link into the chat from this, and the answer that you seek is in here somewhere. It essentially says, though, that after a 10-day isolation, even though if they continue to test positive, that the likelihood of transmission because of that viral load is significantly low. So 10-day is the appropriate mechanism for that. Okay. Is the day of test symptoms day 1 or day 0? That would be day 1, Miss Cool. Sarah read that the saliva test is more reliable. The Pima County Health Department recommends the nasal PCR test. Dexter, oh, thank you, Dexter. Appreciate that. I'm gonna just scroll down and make sure Dexter has got some of those other ones. Here, let me do it this way. So on Dexter, Jessica Montreth, have you gotten that one? And you can go ahead and mute Dexter. We'll just kind of jump through this together.
No. So I don't know who all is doing the rapid tests. I know that the university is, but that's for students and faculty there. So if anybody else has a list of where antigen rapid tests are happening, that'd be interesting to know. I know that the county itself, we're doing a lot of PCR nasal swab tests. So.
Yeah. LE Town Center, I think, is one of the locations that's doing the rapid test with Binax deployment in combination with ASU. Any of the ASU testing sites, which I believe are occurring at Pima Community College campuses throughout the county, that is information we can look at assembling and getting that out on a future call, though. Good question, Jessica. Thank you. Next question from Mr. Olguin. Let's touch base, Mr. Olguin, after the call today, and we will give you some more specified guidance in relation to that question. From first day of symptoms, Miss Loon, if someone has a rapid testing, can you send? Yes, we can. We will send out a list of any of the rapid testing areas out to this group in a mass email. With COVID potential symptoms, is the protocol still the same? 10 days out with improvement in the last 3 days or a negative test after the 5th day? No. So if someone has COVID-like illness or symptoms, then the protocol would be seek testing immediately. If a negative test result or an alternate diagnosis is in place, then all they have to do is wait till symptoms improve and that they are fever-free for 24 hours without the use of fever-reducing medications. They can return at that point in time. The testing in terms of the quarantine situation is only in reference to a 7-day release from quarantine, which means they would return from day 8. And that is after a negative test result, pending the fact that those individuals have followed thorough mitigation. Thank you, Sarah E., for dropping that link. 10-day isolation starts from whichever comes first. Yeah, Dexter, thank you. Thank you, thank you, thank you. Awesome. All right, let's jump back to the agenda. Well done, everyone. That was quick. Just a reminder, close contacts are cumulative over a 24-hour period. Here's the infographic. Close contact means you are within 6 feet of someone for a cumulative 15-minute period within 24 hours with or without a mask. The 4 conditions that do not meet the 15-minute are the timed guidance, providing care with someone with COVID-19, having direct physical contact, such as hugging or kissing, sharing, drinking, or eating utensils, sneezing, coughing, or somehow getting respiratory droplets upon your personage. If you've been in close contact, here are the things that you should do. Everyone should have a link to that document. Arizona dashboard metrics. Let's jump over and cover this really quick. Again, we touched briefly on this on the memo that came out or the email that Dr. Garcia sent out. Dropped that language into the chat. I will repost that again here in a moment. Actually, Dexter, if you could go up, copy that from the chat and repost that in the comments, that'd be helpful. So you can see where we're at here, November 22nd. We are potentially, we're not sure what's going to happen with this right now. Know that this data is backdated every 2 weeks. The percent positivity continues to escalate in the community, as well as hospital visits for COVID-like illnesses in the region. So this is now showing that we are in the red for all 3 benchmarks. So again, this is the 2 weeks notice to begin considering going to remote instruction. Outbreaks in schools. We've talked a lot about school outbreaks. We continue to see social gatherings and home transmission now that athletics are officially off the table, more or less. Those 2 things continue to be the big causes of increased transmission within the community. If your school still is doing athletics, please tell me that you are only just doing solo drill practice, focusing on cardiovascular, muscular strength, muscular endurance, things that you're just doing with solo drilling, maintaining social distancing. So if you're doing basketball, that's solo shooting drills or hotspot drills or cardio work, but there should absolutely not be any close contact in athletics at this point in time. I think we've been really clear on that as a county. So please follow that guidance. If you do have an outbreak at your school site, this is the new letter that we will send you that you can then in turn pass off to your parents. It's editable, so you can add in your school name, enter in the date, and any other pertinent information that you think is important to pass off to the staff and or students and parents of students at your school. We do have this in English and Spanish, so this is available for you all to use. Okay, so we've gotten through the first part of the agenda, and now without further ado, I do want to again thank Mr. Andrew Squire from the City of Tucson, and is it the Chief Public Information Officer, Mr. Squire?
Please call me Andy, and it's the Public Information Officer for the City Manager's Office. And yeah, I'm kind of the point person for the rest of the PIOs across the city.
Awesome. Well, we really appreciate you jumping on this call today. I know there's been a lot of questions from our school partners about overlap between City of Tucson, Pima County, and just general City of Tucson. Some of the stuff that's come out recently. So I'll just keep this page up for you, and then you can tell me if there's anything else you want me to bring up, and I'll mute and let you take it from here.
I appreciate that, Brian. And I don't have access to the chat, which is fine. So if there's questions that pop in through the chat, Brian, if you'll read those out to me, that'd be great. Also, for everybody who's on the call, thank you for all the work you're doing in our community, keeping the schools going. I can only imagine the challenges of that job in this time. So we very much appreciate the effort that our school districts and our school leadership are making to try and make this some sort of reasonably sane year for education. So thank you for that. So the curfew began, Mayor and Council adopted the ordinance the week of December 4th. We began the curfew on December 4th at 10 p.m. The curfew will run through December 23rd, and it's in operation from the hours of 10 p.m. through 5 a.m. nightly. That's 7 nights a week. The curfew is in place during those hours to try to ensure that people are going home. One of the biggest vectors that we were seeing community spread occurring in, based on the information provided to us both through public safety and through our public health partners, were after hours activities coming in many cases from our bar community and in some cases party activities throughout the city. So that's one of the major vectors we were seeing a problem with for a while. So that's one of the reasons that the mayor and council made the decision to adopt the curfew based on that guidance. What basically is prohibited during the curfew is being out in a public area unless you are participating in an essential activity or an essential function. And we've got a really good FAQ page up at the City of Tucson website. Brian has that up on your screen. If you go to cityoftucsonaz.gov, it is on the landing screen. You will see a hot topic slider, which is just the bulletin saying curfew. If you click on that, it will take you straight to this page, which really is designed to answer all of the questions that people have put forward to us through calls and through the conversation with the mayor and council. So right at the top, during the hours of curfew, all persons are prohibited from using, standing, sitting, traveling, or being present on any public street or in any public place, including for the purpose of travel. A lot of folks were asking, what does that mean for restaurants and that kind of thing? And if you scroll down, it will talk to businesses on there. Brian, if you could do that for me. Does this curfew require businesses to close? The answer is no, but we are encouraging operators of businesses like restaurants and bars and any other type of service business that is not an essential service to encourage their patrons to be on the road in time to be home by 10 p.m. Again, the goal is to reduce community spread by encouraging people to think about what they're doing and where they are and staying close to home with their own kind of safe bubble of humans that are healthy at this time. So how was it enforced in that regard? So basically, we're seeing pretty strong compliance with this, and we were largely seeing it for the most part by the majority of our community, even before the curfew was in place, in that a lot of the restaurants and businesses were already closing by 10 p.m. I know even a lot of the Walmarts in town now are closing by 8:30 to allow their people time to restock shelves safely in the stores, which is a pretty unusual business model for them. Normally they're 24 hours, right? So that's a big change on their part. Officers on patrol will be advising individuals that they encounter as a part of their regular patrol duty of the curfew, and then they will encourage them to comply with the curfew by getting to their homes as soon as possible, unless they are engaged in one of the essential functions or activities. And yeah, Brian, that's not even listed in there. That's just me knowing my talking points to the press. So the essential activities and the essential functions are really going to be the critical piece that folks will want to understand. And it's pretty common sense. It's obtaining the necessary supplies. It's engaging in healthcare activities, getting your groceries, going to take care of a pet, going to take care of a family member. And if officers find people out past hours, they're going to use their discretion to ensure that the individual is aware of the curfew, and largely, they're going to be issuing warnings or just letting people know about it. Thus far, since the first weekend it was initiated, we saw very minimal enforcement activity. This weekend, we had over 34 warnings provided. That's Friday, Saturday, Sunday evenings. And then just last night, we actually had 41 warnings provided. So we had a big surge in activity last night. So I'm determining what's happening there with our Tucson Police Department. That, in a nutshell, is the curfew. So Brian, I would leave it to you if there's more information that's needed, or if in fact there's questions coming from the participants today.
Yeah, so I did drop the link to the page that you're seeing in the chat, everyone. So you can copy and paste that over or click it and save it as a favorites page. There was a question here. Since the risk, and I'm just going to read this verbatim because it's a good comment.
Sure.
Since the risk for nightly celebratory events is higher over the holidays, I'm wondering why the curfew ends prior to the holidays. For example, before New Year's Eve. I realize my questions make me sound like a Scrooge.
So I am not certain what the decision was for mayor and council on that date. I believe it was in line with other guidance that was being provided at the time through either CDC information or possibly in partnership with some of our health partners. I would be happy to get that answer and provide it to you, Brian, to be shared out with the group. We've had that question fielded a few times through both the press and the others. The key piece there is it may have been statutory just as far as the amount of time that we were permitted to take this action. So I'll check with our city attorney and see where we're at on that.
Great, thank you, sir.
You're welcome.
Any other questions here for Andy? And if you are willing, you can go ahead and unmute and ask those questions now as well. For all the teachers on the call, this is called wait time.
The other thing I will stress is the penalty for breaking curfew is a maximum fine of $300. The city attorney made it very clear that, you know, diversion would be an option if somebody was really in violation of that. Again, considering the size of our city, the number of warnings have been fairly small. They did increase quickly over the last week, which means our police officers have a better comfort level with the implementation of the warning process. So that's what's happening at this point. One other thing I'll share from our City of Tucson webpage, and I know this is something we're working on very closely with Pima County and the Pima County Health Department, is the utility assistance. Big diversion from this conversation, but for a lot of you, you may be encountering families in your schools who are having problems paying bills. That creates a whole different level of stress for these families and likely the ability for the students to do well. Just one more factor. The City of Tucson on the main webpage also has the main link for the utility bill assistance page, tucsonaz.gov. That's actually, go ahead and just hit the main page. If you'll just click the City of Tucson at the corner there, right there, that big sucker.
Nice.
And that is a one-stop shop in partnership with Pima County. They set up that webpage to find the assistance links for all of the agencies providing assistance with bill or utility overages, overdue payments, including Tucson Water, Tucson Electric Power, and Mayor and Council allocated, I believe, over $3 million to that effort. Excuse me, $3 million was the larger program. That was going to be $500,000 per utility, so roughly $1.5 million to assist both power, gas, water, sewer, and environmental services assistance. So families can apply for that assistance by using that link and get in touch and make a plan, because there are millions of dollars in overdue fees and thousands of our citizens who are behind. And we really want to ensure that they're going to be okay moving into the new year.
Awesome. Well, thank you, sir, very much for your time today, your communication, and the work that you're doing with the city. Yeah, we all know that this is a really challenging time out here, and I appreciate the city's efforts and outreach to support our community and financial assistance, utility assistance.
Thanks, Brian. We really appreciate. Wow, we got a soundtrack. That's nice, Brian.
I was just wondering. I'm looking to see who that is, so I can try that.
Brian, great segue.
Brian, I have one last question for Andrew, if you don't mind. I work closely with seniors who are applying to colleges, and sometimes we do go pretty late. Is there something I need to have on my drive home? Should I pass that 10 o'clock curfew?
No, you're performing an essential function, and again, it is unlikely that the police department will be pulling you over because they think you're out past curfew. It would be more likely that some other activity is occurring. There's a reason for the vehicle stop, or even if you're walking or cycling, it's very unlikely that you would be pulled over or stopped in that case. It's more common that you're going to see that curfew warning happen when you see multiple people gathering together. So for instance, they just finished up their time at the bar or the restaurant, and now they're lingering and congregating together in a small group, and that goes on. Most of the stops that are occurring, ma'am, are happening past midnight. So even if you are out late taking care of that activity, that's not something to fear. And again, at most, let them know what you're doing, and that they're going to accept that.
Okay, thank you.
You're very welcome. Thanks for asking that question. So Brian, with that, I'll turn it back over to you and say thank you for whomever the soundtrack was from. That was a nice transition. And again, our thanks to Pima County, the Pima County Health Department and their PIO team, communications. This is a huge collaboration and partnership, and we very much value that. So thank you.
Yeah, just a footnote, Andy, I am getting a hello from Ernie Duarte.
I saw Ernie Duarte out there. Hello back, Ernie. Miss you, man.
Cool. All right.
Thank you.
Yeah, thanks again, sir. I appreciate it. If anyone on the call has future questions for the City of Tucson or needs to get connected, just reach out to us and at either EOC Education at pima.gov or any other communication channel, and we can get you linked up with those resources. All right. So there is one other quick thing on the agenda today. That's the PCHD holiday guidance. We did kind of go over this last time, but I want to bring this up again just to show you all that there is here on this page, the link is in the agenda. Guidance for various holiday celebrations. Once you click on this, there's an additional drop-down menu that gives you additional mitigation. The intention for this was, as you have communications with your parents, your faculty, you can essentially just copy, paste, not cut, but copy and paste this information and drop it into communications for the families or for the staff that you interact with at your additional school sites. We are in Hanukkah right now. I believe we're on day 3 or day 4 of the Hanukkah celebration. So again, there's some really appropriate information in here that you can use as communications materials to try and keep the communities that you interact with safe during this holiday period, which we know is going to cause increased transmission. I'm going to jump back up to the 2 weeks notice one more time just to make sure that everyone has gotten this. I'm just going to copy and paste this into the chat. And I will make sure that we email this formally out to everyone on the call. Again, the recommendation, this is from the county. We are giving you the 2 weeks heads up notice that it's time to start considering going remote. Some of the questions that I saw in the chat earlier is when will the recommendation go back to hybrid after the virtual recommendation is in effect? I don't know the answer to that yet, Sarai. I've heard from schools across the board. Some schools are going to wait till after the Martin Luther King Jr. holiday, which I believe is on the 14th of January this year. I was just going to my calendar to see if I can find that on. Nope, too much. I'm just going to close that out. So it really is up to the schools to decide when to go hybrid at this point and when to go to remote. Ultimately, that's their decision. We don't have a date for when we'll make that recommendation. What I think, oh, thank you, Min, the 18th of January is MLK. So I know there's a lot of schools that are considering waiting until that date elapses to start to go back. Primarily because that'll give you enough cushion after New Year's celebration to have a 14-day period of quarantine effectively for your community and to kind of lower that that rate of cases in the community before a return to campus. For recommendations for preschool daycare centers, that's actually a really timely question. I was Rebecca O'Brien, are you on the call right now? One of my colleagues, Rebecca O'Brien, is running the Early Childhood Care Preschool Daycare Center group, and she is saying that her laptop mic is really bad. But we were just talking today about setting up a possible weekly call for preschool or daycare centers. So just kind of be aware that those conversations are happening, and those centers will get a similar format to what we're doing with this weekly meeting for you all. Okay. What else was I going to talk about with that? Oh yeah, recommendation for return. The biggest thing that will guide our recommendation for return will be these benchmarks over here. So I'm going to jump over to those really quick. Where is the data? Data and stats. Right here, the progress report. So when we start to see things go to yellow, that's when the quote unquote official county recommendation to return to hybrid instruction will be a go, is when everything's out of the red within these disease data metrics. We've talked a lot about the consideration of hospital bed capacity. Right now, our hospitals are in a bit of a situation. I don't know the current status today, but I know last week we were completely out of ICU beds for all of the county, and that's for the intensive care units. Again, there is the one of the things that is important to note is that we're much better at caring for patients who have COVID. So because of that factor, we're able to address any condition before it gets really serious and either mortality or morbidity occur as a result of a COVID infection within the county. Okay, so with that concludes the call for today. We are going to stop recording at this point. If there's any comments or questions, feel free to go ahead and start dropping those in the chat.